Well, get this, South Africa has been under lockdown for 8 months. That's nearly 250 days. The experts say a vaccine could solve the problem, but some South Africans are not convinced. In fact, quite a few think it's a bad idea. It all begs the question, if we do get a vaccine, will we take it? Let's get some answers. Michael Marillier joining us in studio for this one. So, Mike, the scientists say the vaccine could end the COVID crisis, but here's the thing, people have to actually take that vaccine in the first place.
Absolutely, Shahan, and here is a picture of that COVID-19 virus, which has been bothering us for so long here in South Africa. As you mentioned, 8 months. We really are getting tired of it. The experts saying, Shahan, that this could be the answer. Of course, a vaccine. There's the little bottle and the injection, which perhaps we'll someday be taking. 3 companies have already released word or statements indicating that their vaccines are 90% effective. But as you mentioned, COVID-19 went viral. COVID-19 was the problem. The solution must also go viral. Vaccines only work if people take them and if a lot of people take them as well. Now, remember, Sean, COVID-19 is a global problem. So the experts at the WHO say the entire world will need to take a vaccine in order for it to actually become effective. Otherwise, we might face localized lockdowns around the world. So how are we positioned in terms of vaccine acceptance? We're going to focus on a study by Ipsos, which was conducted just over 6 weeks ago, Shahan. The key question, will people around the world actually take the vaccine once it becomes available? Let's bring that up. The stats really are fascinating. And South Africa's position on it also really quite interesting as well. The global average, as you'll see right there, Shahan, 73% of people saying yes, they would take the vaccine if it was available. India registered the highest numbers, 87%. France, the lowest figures in this particular study, 54%. As for South Africa, Shahan, 68% of us said we would take the vaccine if it became available in this country. Now, that number is important, Shahan, because the experts tell us that we need vaccine coverage of 60 to 80% in a population in order to have some sort of protection. So 60 to 80% of the population needs to take the vaccine. If it doesn't, Shahan, we could well end up in a situation like this. These are the kinds of scenes that we're seeing in hospitals across Europe as well as North America. A lot of hospital staff under pressure and taking tremendous strain. And that's what we want to avoid. That's the reason we had a lockdown in the first place, to avoid a situation just like that.